So why can't you hear a pneumonia patient urinating? Because P is silent. And scientists have discovered another deadly pathogen they are calling the peekaboo virus. Doctors are sending anyone with peekaboo pneumonia straight to ICU. Hi everybody, it's Dr. Ryan here again with another hard-hitting algorithm in internal medicine. A big thank you to everybody who's been liking and sharing my videos and subscribing to my channel. God bless you, I truly appreciate it. So we're breaking into the discipline of infectious disease this morning, and we're going to try and break down 32 diverse etiologies behind pneumonia. Let's get going. So pneumonia actually refers to infection of the pulmonary parenchyma with characteristic symptoms, physical findings, and radiographic findings as well. Now, symptoms of pneumonia include dyspnea, cough, sputum production, pleuritic chest pain, chills, malaise, and confusion. Physical findings of pneumonia include fever, tachycardia, tachypnea, cachexia, dullness to percussion, increased tactile phlegmatis, bronchial breath sounds, inspiratory rales, pleural friction rub, agophony, and whispering pteryloquy. Despite a cadre of available diagnostic tests, a specific pathogen may not be identified in many cases of pneumonia. Empiric treatment is often necessary. Now, pneumonia can be acquired in the community or in the hospital as depicted in our algorithm. The subcategories of pneumonia acquired in the community setting are community-acquired pneumonia and endemic pneumonia. Now, community-acquired pneumonia can be caused by typical or atypical pathogens. Typical bacterial pneumonia tends to present acutely with systemic toxicity, whereas atypical pathogens are associated with more indolent symptoms and signs. Now, the subcategories of pneumonia acquired in the hospital setting are HAP and VAP, which are hospital-acquired pneumonia and ventilator-associated pneumonia. Hospital-acquired pneumonia is defined as pneumonia occurring after 48 or more hours of hospitalization in non-intubated patients. Ventilator-associated pneumonia is defined as pneumonia occurring after 48 or more hours of endotracheal intubation. Now, aspiration pneumonia occurs in both community and hospital settings. The most common pathogens in each category of pneumonia are distinct and affect the choice of empiric antimicrobials. Environmental factors like local antibiogram data and host factors like drug allergies, severity of illness, presence of risk factors for drug-resistant pathogens should also be used to guide empiric therapy. And we all know of the Curve 65 score, with which we can predict the severity of pneumonia. So C stands for confusion, U is urea above 7 millimole per liter, R is respiratory rate above 30, B stands for blood pressure, systolic less than 90, diastolic less than 60, and 65 is age over 65. If you've got two or more of those positive, inpatient management is strongly advocated. So let's talk about community-acquired pneumonia on the left-hand side of the diagram. Right? This is largely divided into typical or atypical, or it can be endemic. So typical is our usual trio here: Streptococcus pneumoniae, Haemophilus influenzae, and Moraxella catarrhalis. Atypical includes viral causes, especially coronavirus, guys, in this day and age. Mycoplasma pneumonia, don't forget. Legionella, which is associated with air conditioning units and so forth. Chlamydia pneumonia, Coxiella burnetii, watch for this in people who deal with livestock. Francisella tularensis, so-called rabbit fever, right? Then looking at endemic causes of community-acquired pneumonia, TB, very important in TB endemic countries. Coccidioidomycosis, histoplasmosis, blastomycosis, cryptococcosis, all our fungal pneumonias. Okay, watch out for those who are immunosuppressed. Right, then of course, aspiration pneumonia can happen both as community-acquired or hospital-acquired. So here we're looking at our anaerobes largely: Streptococcus, gram-negative, bacilli, Staph aureus. There's also Peptostreptococcus in here as well. Hospital, we're talking about HAP and VAP. So HAP happens in patients who are in hospital for more than 48 hours and not intubated. Here we're thinking about enteric gram-negative bacilli, Haemophilus influenza, Streptococcus pneumoniae, Staph aureus. Watch out for methicillin-resistant Staph aureus as well here. Pseudomonas aeruginosa, Acinetobacter baumannii. Then ventilator-associated pneumonia, as the name implies, happens in those who are ventilated. So looking here mainly at the enteric gram-negative bacilli, Staphylococcus aureus, Pseudomonas aeruginosa, Acinetobacter baumannii. Alright, so here is a funny diagram, courtesy of George Munoz over at medcomic.com. Thank you, sir. So he says the typical CAP or community-acquired pneumonia refers to an acute infection of the lung parenchyma acquired outside of the hospital or less than 48 hours after admission. It entails fever, cough, sputum production, dry hospitalistic chest pain, dyspnea, and tachycardia. All right, and here we can say the most common cause of typical cap is Staphylococcus pneumoniae. We see here Diplococcus, bronchial breath sounds and crackles and auscultation. So they say speaking to agophony. Okay, that's agophony, one of the signs that we have in pneumonia. And specific findings due to local consolidation include agophony, which is E to A, whispering particularly, and tactile phlegmatis is increased. See, 99, 99, 99. You guys know all the deals right there. And of course, I have an infiltrate on the chest radiograph. Watch out for parapneumonic effusion as well, which can be a complication of pneumonia, as well as lung abscess, right, as well as overwhelming sepsis. Here's a question. A 75-year-old man has profound obtundation, pneumonia, and a vesicular rash. All of the following are appropriate therapies except... So guys, I'm sure you can see this follows more like a dermatomal distribution, so this speaks to herpes zoster. So in the setting of this, the correct answer is actually corticosteroids. Alright, let's talk about herpes zoster quickly. It is a primary infection with VZV, varicella zoster virus commonly occurring in childhood, manifests as chickenpox. Infectivity is the highest just before the onset of the rash. And the virus then may enter a latent stage and remain dormant in the dorsal root and cranial nerve ganglion. Important for us in the setting of this particular video, illness associated with varicella zoster includes varicella pneumonia, as well as encephalomyelitis, zoster ophthalmicus, shingles, cerebral ataxia, acute retinal necrosis. All right. So, guys, as always, something just to encourage you today. I'm going to be speaking on the topic of the mind. So, Napoleon said, and I quote, "Whatever the mind can conceive and believe, the mind can achieve." There's an ancient Chinese proverb which also goes like this: if your mind is strong, all difficult things become easy. But if your mind is weak, all easy things become difficult. My pastor at Angelus Mission Church here in Durban, South Africa, Pastor Mark Naidoo, said, and I quote, "The poorest person in the world is the one who has a negative mindset." Of course, our blueprint for living is the Bible. So what does the Bible have to say about the mind? Just two scriptures I'm going to quote for you. Romans 12 verse 1 to 2 says, "Do not be conformed to the pattern of this flesh, but be transformed through the renewing of your mind, so that you may discern what is the perfect and pleasing will of the Father for your life." Sorry, that was Romans 12:2. And the preceding verse says, "I beseech you, brethren, to offer your bodies as living sacrifices unto the Lord, holy and pleasing. That is your spiritual act of worship." Okay. Philippians chapter 4. Okay. Here Paul is exhorting to those in Philippi in verse 8. So I'm going to pick it up from verse 8. It says, "Finally, brothers," and look at these adjectives, powerful adjectives here, guys. "Whatever is true, whatever is noble, whatever is right, whatever is pure, whatever is lovely, whatever is admirable, if anything be excellent or praiseworthy, think about such things." All right. So I pray that we will decide to keep our minds pure. For your thoughts, as we know, are very important. They determine your actions, they determine your habits, they determine your character, and that forms your destiny. Have yourself a wonderful day. I'll catch you tomorrow with another algorithmic approach in infectious disease. God bless you.